Good morning, and thank you all for joining us for today's digital briefing on how COVID-19 is affecting Black communities. My name is Akunna Coook, and I'm a senior fellow here at Third Way. I'm excited to report we have over 300 Democratic strategists, donors, policy experts, and elected officials joining us today. Our guest today needs no introduction. He is an institution in American politics, having served as House Majority Whip twice. He's been chair of the House Democratic Caucus, chair of the Congressional Black Caucus, and we're proud to say he's an honorary co-chair of Third Way. These days, Whip Clyburn is playing yet another major role in our country, overseeing the $2 trillion relief package that was signed into law by President Trump just a few days ago. And we're delighted to have him with us to talk about how COVID-19 is affecting Black communities. Also with us is Matthew Ellison, who serves as Deputy Policy Director in the Office of the House Majority Whip. He's returning to this office having served with Congressman Clyburn as both a staff assistant and legislative assistant. So thank you to you both for joining me today.
Thank you so much for having us.
So I want to just get right into it. When we began this briefing series 2 weeks ago, we had not seen the numbers that were coming out showing the devastation in Black communities with the disproportion of deaths. But we knew that whatever was going to happen in the US economically would be, impact Black communities, because as they say, when America catches a cold, Black America catches pneumonia. Now we're starting to see the numbers coming out of Michigan, where 40% of deaths are Black deaths, despite the state only being 14% Black. In Louisiana, you see 70% of Black deaths, despite the fact that the population is only 30%. And we're seeing in Milwaukee and Chicago, et cetera. As you are thinking about your role overseeing the relief packages and also starting to think about future packages, what are your priorities for what needs to be a part of the solution as we think about recovery in Black communities?
Well, I think that, first of all, thank you so much for having me. Thanks to all of those who are joining us. If I might just start this with a personal note, I just received notice this morning that a first cousin, 30 miles away, passed away this morning of COVID-19. So these things are very, very personal. Here in South Carolina, we are about 28% of the population in the state, but we're over 50% of the deaths. So we know how disparate these numbers are. And we are very, very concerned about that. That is why when we were putting this package together, I made a statement that this is a tremendous opportunity for us to restructure some things more to the vision of those of us who believe that our healthcare system ought to be accessible and affordable by all. We believe that rural hospitals ought not be closing. We've closed over 130 rural hospitals in this country, 4 here in South Carolina. We ought to have community health centers within commuting distance of every American. We ought to have broadband deployment so that we can reach everybody with telehealth or telemedicine, if that's what you prefer. Today, with all of our kids out of school, and many of them are getting online learning, what is happening to those young people who are not connected to the internet? They are going to be left behind. And we are now it's now being predicted that we may have a second round of this in the fall, which means schools to be closed again. So a lot of young people in low-income communities, in minority communities, could be left out or left behind for 2 years rather than 1. So that is what this is all about. We have to take a hard look at our educational structure, at our infrastructure, at our health infrastructure, and see what we can do to make sure that everybody has access and everybody can afford the greatnesses that we have in this great country. So that's what this is all about. We attempted to do much of that with CARES. And we have seen that some things are lacking. This is to be expected when you put a bill together as quickly as we put this one together. And then it is to be expected when you have the White House being unrealistic and you have the Congress trying to respond to the real issues that are out here. And even in the Congress, you have the Senate in the hands of the Republicans and Mitch McConnell still playing games. We need some emergency funding for the CARES package. But he put a bill on the floor last week, knowing full well that Democrats would not agree to that. But what he's doing is looking for a political message. And I get those messages from people. I just responded to one this morning saying, come on, let's not play into the games that Mitch McConnell is playing. Let's look at what this bill is doing for small businesses. And I would ask anyone in the audience here today, take a look at the CARES bill that Mitch McConnell put on the floor and then compare it to the CARES bill that finally passed. When everybody was blaming Schumer and Pelosi for holding up the bill, I've seen the letters to the editors. We weren't holding up the bill. We were trying to make the bill real for everybody. More small businesses, minority businesses. And then we still left some stuff out. And let me give you one little incident that has already occurred that I want your folks on Third Way to think about. A young man employing more than 300 people came to me because when his businesses, he has a bunch of fast food places, when they got in an economic downturn, he filed Chapter 13 bankruptcy to reorganize the business. And he was following the plan perfectly until the pandemic hit. Now, under the rules, he has to go out of business and they have to lose their jobs because it's expressed that if you're in bankruptcy, you cannot participate. That's not Chapter 11 he's filing. He filed in Chapter 13 to reorganize, and he's organizing perfectly well. But now he cannot participate, so now his employee is going to be out of work, and he's going to be out of a business. That's the kind of thing we're trying to look at with this emergency funding in order for minorities and small businesses and people who've been struggling can participate. I could see it if he was in one of the other chapters, but not in Chapter 13. So these are the kinds of things we're trying to do with this bill. We have small communities, towns and cities wanting to participate and need relief. And here's Mitch McConnell putting the bill on the floor, ignoring them. We have some small businesses. Matthew Ellison, who's on the line with us today, can tell you some of the experiences we're having here in South Carolina, and we have them all over the country. People need to be able to look to their government for relief in a situation like this. It is a shame that our Republican colleagues still wish to play games rather than do what is necessary to get the American people back on their feet.
Thank you, sir. I'm glad that you mentioned how politicized the relief efforts have become with the Republicans taking their cue from President Trump. You know, in the beginning, he made it clear that he was going to be using the rationing of supplies and PPEs to reward his political friends and punish who he felt were enemies. Just a few days ago, he mentioned that as president, he has total control. And of course, he walked some of that back yesterday. But if we look at the states where Black communities are located, over half of them are in states that are Republicans. And so have you thought about, or have you, as we're thinking about future packages, thought about ways that we might be able to empower local leaders, many of whom, if they represent Black communities, tend to be Democrats. Is there a way for us to empower local leaders as we're thinking about future packages so that our communities aren't suffering because of the politicization, both with Republicans in the Senate and of course the president himself, but also some of these Republican governors taking their cues from the White House?
Absolutely. Back when we first put together the Affordable Care Act, we put that act together trying to make sure that we had health care accessible and affordable for everybody. You may recall, one of the discussions we had was having the so-called public option, which we could not get support for or enough support for, and therefore it got left out. Now, after the Supreme Court took a look at the bill, that is the law, and ruled on it, it determined that Medicaid, for instance, would have to be agreed to by the states. And I'm saying this in layman terms. Now, the lawyers like Matthew on the line will probably say it differently, but what happens is the states will have to move to expand Medicaid. South Carolina is one of those states that choose not to do so. That is one of the things that we're trying to address in the legislation now. What can we do in these states that did not expand Medicaid? Do we go forward and just leave these people out of the equation, or do we do something that can bring them in? We're trying to work to bring them in. That's one of the reasons I have been proposing that we, in this next round of funding, put money for mobile units to go into rural, remote, and persistent poverty communities, because we are not going to track and trace, we're not going to test, and we are not going to find, deliver cures if we do not take these issues out into these communities where the mobility is not what we would have it be. They don't have the transportation. They can't go to these drive-up facilities. I talked to the governor of South Carolina. He agreed with me. He has 17 sites for people to drive up to. All 17 of those sites are in urban areas. They're not in the Sea Islands of South Carolina, North Carolina, Georgia, and Florida. And these are places where people come to vacation. These are places where the economy turns on tourism. And you're not going to get the economy stood back up if we don't get testing out into these rural communities, because that's where the results are. That's where the golf courses are. That's where people are going to be going to vacation, and they are going to these places unless they can feel that their health will not be endangered. That's why we have to do this. So yes, we're doing it. We wish that people will pay close attention to what we are proposing and not listen to the foolishness that we're getting almost every day coming out of this White House.
Thank you. So I want to remind our audience that they can ask questions and submit questions. We have a few coming in using the Q&A feature. Congressman, one question that we have is about the 10-20-30 plan that you proposed coming out of the last recession. So you proposed it to have 10% of federal funds go to counties where at least 20% of the population has been in poverty for at least 30 years. Vice President Biden has, and other Democrats have embraced this as part of their economic plans. And so just to talk a little bit about how you see the 10-20-30 plan addressing some of the recovery efforts as we look long-term coming out of the COVID-19 crisis, and would love to just hear insights on how you're thinking about this.
Well, thank you so much for raising that issue. 10-20-30 came into being when we were putting together the so-called ARRA, the American Recovery and Reinvestment Act. That was the stimulus bill that we used back in 2009, proposed by President Obama. During that discussion, I talked about these persistent poverty counters, over 500 in the country, and I didn't stipulate their existence. The Census Bureau did. The Census Bureau says that any community where 20% or more of the population's been stuck beneath the poverty level for the last 30 years, is classified as a persistent poverty community. So I said in those debates that what we ought to do is target resources into these communities. And I just came up with, say, 10, 20, 30. It just sounds good. So let's put 10% of all the money that we appropriate in here, target it into these communities where 20% or more of the population been stuck beneath the poverty level for the last 30 years. Well, it was a little bit unusual. They didn't agree with me totally, but decided to let me try it in 4 sections of the ag bill in the recovery package. It worked famously. 3,600 communities got funding for water systems. Many of them have been trying to get water systems for 40 and 50 years, and other kinds of infrastructure issues. And so now the Republicans have agreed. They agreed earlier when they were in charge of the House to put the formula into 15 sections. We tried 17, but we got 15 approved of the appropriations bill. And it's there now. And we just found out on yesterday, and I thank the chair of the Financial Service Committee, Maxine Waters, for now putting 10, 20, 30 into some of her COVID-19 legislation. And that can be done throughout. That way we can make sure that these persistent poverty communities don't just get talked about and prayed over, but we direct some of these resources into them. I have been born and raised in Apostles, and I know the thousands of times that the poor is mentioned in the Bible, and we pray for them. But my dad used to tell me all the time, the fundamentalist preacher, yes, pray for them, but let's work to get resources into their communities as well. And so what I want us to do here is not leave these people out of this recovery. That's what happened when we came out of the Great Depression. That's why I'm one of those Democrats who are what you call a big fan of the so-called New Deal, because the New Deal was a raw deal to a lot of the communities that I represent, because the CCC and WPA programs had a little tag hung on them in the South. They were white only. I want to see every community come out of this situation, this recovery fairly. And we cannot do that unless we target resources into these communities. And that's all 10, 20, 30 years, making sure that we target 10% of whatever is appropriated into those communities where 20% or more of the population's been stuck beneath the poverty level for the last 30 years. It is working famously in rural, low-income communities, and we ought to expand it throughout the government. And Joe Biden has agreed that if he's elected president, it will be expanded throughout the government.
Thank you. So we have a lot of questions for you on politics. You mentioned, or I should say, everybody knows now the tremendous role you've played in the primary process so far, and using your influence and being such an influential voice in South Carolina. But we're also starting to think now about November, and particularly around voter suppression. We know that voter suppression that the Republicans are carrying out is going to disproportionately affect African Americans. We saw this in Milwaukee, where the Supreme Court weighed in and essentially forced folks to go out and vote in the middle of the pandemic. And then we saw last night that the Kentucky legislature overruled the governor there, instituting a voter ID law. And so how are you thinking about how we adjust our mobilization efforts given what's happening with COVID-19 to ensure that Black voters are going to still have access to the ballot?
Well, thank you for raising that, because I feel very strongly about this. Having been born and raised here in South Carolina, I know what voter suppression is all about. In fact, after Supreme Court decision, the most recent one that kind of neutered the Voting Rights Act of 1965 by rendering Section 5 almost useless. South Carolina is one of the first to pass a voter ID law. But by the time we finished the court case, that voter ID law didn't have much impact. But let me say this to people who are worried about this. I worry about voter suppression. I worry about what we can do to overcome it. But let me say emphatically, we have ways and means of dealing with voter suppression, and we ought to dedicate certain aspect of our process to doing that. But we've also got to have people working on what ifs. If we have a Supreme Court, and we know what we have, that will do nationwide what they did in Wisconsin, are we prepared to help voters respond the way the voters responded in Wisconsin? Yes, President Trump thought he had done a great thing by endorsing the right-wing Supreme Court justice, and he, the Republican Party, and the United States Supreme Court forced the election forward in some real dire circumstances. But the people responded in such a way, the guy lost. It wasn't even close, lost big. Why? Because people didn't spend all of their time weeping and gnashing while the people were fighting the case in court. Other people were out organizing the vote. And so what I'm saying to people, yeah, let's fight the voter suppression, but let's not put all of our energy in that. Let's make sure that we begin now to organize. I love Nancy Pelosi's mantra. We don't agonize, we organize. Yes, some people, if you wish to agonize, go ahead. Jim Clyburn is going to spend his time organizing. I am organizing to turn out the vote here in South Carolina, not just for Joe Biden, but I want to turn out this vote for Jamie Harrison as well. And that's what we've got to do. We can win up in North Carolina if we organize. We know what we're up against. We know it right now. That's not going to change. Let's start organizing in Georgia, in North Carolina, in South Carolina, not just to win presidencies, but we need to win at the state and local levels as well. I tell people in my state all the time, no president has ever been to your school board meeting. You've got to elect people to the school board, irrespective of who may be the president. And so to do that, we need to organize and turn out the vote. So yes, there's going to be attempts to suppress the vote, but we have overcome before, and we can overcome again.
Well, I'm glad you brought up Jamie Harrison and his Senate race. One of the questions we have is just to give us some insights on how that race is going and whether or not we've got a shot and what we can do to support that race.
Well, I tell you, help us organize, help us fund. Jamie Harrison in the last quarter raised, the last quarter of last year, $3.5 million. And everybody was talking about, that is magnificent. No Democrat has ever done that before in South Carolina. Well, I have not seen it yet. Today is the day that we are supposed to file. And so he's got to file today. So my saying this is not going to destroy anything or take anything away from him. I will say that by midnight, he will double in this quarter what he got in the last quarter. Jamie is doing a great job. He is committing himself to the fundraising. People are responding, and his polling is great. Nobody ever thought that he could poll the way he's polling. I've seen 2 polls that got him leading the incumbent in that race. And I think that he can win if we all don't agonize, organize.
That's right, sir. Shifting gears a bit to an item that's been in the news over the last couple of days, you have said that Vice President Biden has said that he will choose a woman to be his vice presidential pick. You have come out and said that you think it should be a woman of color. There was a New York Times op-ed yesterday saying that it should be Stacey Abrams because of her particular strengths with Black voters and with younger voters and Latino voters, and an article that came out in Elle today arguing for her experience. And so how are you advising the Biden campaign or the vice president himself about how to think about a potential VP pick?
Well, the vice president said himself, the former vice president, said that if he were to get the nomination, he would select a woman. So that much is done. What I said was, being the father of 3 African-American women, I favor it being an African-American woman. Now, I don't believe that it has to be. I would love for it to be. The fact of the matter is, there are a lot. Stacey Abrams is a good candidate. I've mentioned would be a good candidate. There are a lot of other people as well. Kamala Harris, I think, demonstrated great political acumen out there. I've talked about my good friend, Marsha Fudge, who I think is one of the most brilliant minds in the United States Congress. There are others out there that he could choose from of color, and some. I think Amy Klobuchar is a great person. I think Elizabeth Warren is great. I think there are women that he can choose from. I think that he ought to put together a group of advisors to look at everything, do the polling that's necessary, do the vetting that is necessary, and let's make sure that we get somebody who is female, but who also is compatible with him and can complement the ticket. That's what's most important. I think gender is very, very important. Skin color, important, not as much as gender, but important. I think we should really look at that and come up with the best possible candidate.
Thank you, sir. One question from the audience: how concerned should we be about President Trump's clear efforts to subvert congressional efforts, your efforts, to ensure oversight of the funds allocated through the COVID-19 legislation? What can we do to make sure that huge sums are not being misused?
Well, I'm glad for that question as well. When Nancy Pelosi called me several days ago and said that she was planning to put together this committee to do oversight, she mentioned the Truman Committee. Now, Speaker Pelosi knows my fondness for Truman. I just talked about the fact that the New Deal was not all that good for my communities. The fair deal that Truman put in place was better. I've been a fan of Truman for a long, long time. So when she called me a second time to tell me that not only was she going to put the committee together, that she would suggest that I chair the committee. She asked would I be amenable to doing that. That was like throwing a rabbit in the briar patch, because I've been studying Truman all of my life. I knew a lot about that committee that was stood up March 1, 1941. When Truman made the statement going in to World War II, that we needed a committee to take a look at how money was being spent. He had gone around to all of these military bases, and he saw what happened after World War I. 116 committees were appointed to take a look at how things happened in World War I. All of the profiteering that took place, the price gouging, the fraud, 116 committees. Truman said it would be much better to get one committee before the fact than 116 after the fact. That's what instructed Nancy Pelosi on this. And I'm glad that she, and very proud of the fact that she showed the confidence in asking me to chair it. That's what we're going to be doing with this committee. We are going to take a look at everything Mnuchin does in passing out this money. We're going to see where they go. We're going to take a look at who these people are to see whether or not they are qualified to be getting this money, making sure there ain't no fly-by-night groups organizing for the express purpose of being a repository for the money. We're making sure that we aren't playing favorites and we aren't punishing people, that we are responding to what is necessary for the American people. So I have had discussions with the staff that we are going to be utilizing to put this together and carry out this responsibility. I hope that we can really get back to Washington real soon and get up and going with this group, because I don't want too much money going out of the door before we get a chance to look at it.
Well, I think we can all agree that we're glad that you're on the case and that you are making sure that these funds are dispersed responsibly. Another question from the audience: what can we do to build resilience as a community for minority folks, people of color, going forward to help us better prepare for possible pandemics in the future?
I think that what we have to do really is admit that we've got a problem. You're never going to solve a problem by ignoring it or pretending it doesn't exist. That's what's going on today. We've got to admit that our healthcare system, the healthcare delivery system, needs to be restructured. It's no question about that. We've got to admit that infrastructure in this country is crumbling. And when I say infrastructure, I include school construction, I include housing, I include water and sewage. Nothing is much a bigger threat to health in this country than the water we drink. I've looked at the studies done, one particularly down at the University of New Mexico, where 90%, they came to the conclusion, the researchers, that 90% of the extension of life in this country, of life expectancy being over 80 now, is because of the water we drink. That's infrastructure. We have got to admit that we've got infrastructure problems here in South Carolina. Those old mines are poisoning the water table. And so we've got to have water systems to deal with that. And broadband deployment. We're not going to have telehealth delivered to people. We're not going to have education adequately delivered to our children without broadband. And to have communities where only 25 and 30% of the homes are equipped with broadband. Schumer told me that 25% of the children in New York City are not connected to the internet. And so we have to have telehealth to deliver healthcare. We got to have broadband to educate our children. We got to have infrastructure. That's what we've got to do going forward. Get serious about making sure that the greatness of this country is accessible and affordable by all of its citizens. That's the vision that I was talking about, that my Republican friends are trying to weaponize. I will never back away from that. And I would think that all Democrats would do well to go out here and make that the message, because that's what's going to galvanize people to get to the polls in November. That is what we need to be doing.
Thank you. Another question about the data that is available as about how COVID is affecting the Black community. We've seen calls from folks, both in Congress, mostly Democrats, asking that more data be collected and made available on how COVID is affecting the Black community. What do you think are the best strategies to get more leaders on board to get this, to collect this information and then to get it out and disseminate it?
Well, I think we're doing a good job there. What we got to do is just decide that we're going to spend the money. We're just not going to get it done by skimping. We've got to see what is required to hire people to go out and get this information. Someone said something about, there's a group up in, I think up in Boston, doing great work with tracking and tracing, doing great work with the testing thing. And people are saying, well, it'll take 10,000 people to do that. So let's get 10,000 people going to work. We've got more than 10,000 people right here in South Carolina drawing unemployment checks now. So let's go out there and invest the money on people going out in these communities, getting the testing done, getting the tracking and tracing done that needs to be done, and sure, pay them to do it, but we're paying them to stay home now because they're unemployed. So what's wrong with that?
So you bring up a great point. We have talked before this pandemic in the Black community, we've talked a lot about the future of work and how it was affecting Black communities because so many of us are in the kinds of service sector jobs that were being phased out by automation. Now we're seeing that a lot of those jobs have been phased out by this pandemic. How are you thinking about how we start to use this, for lack of a better word, opportunity where folks are out of work to start to move people and start to think about how you retool them and give them skills for the jobs that are in the future, or there are many cases of not here now because of the pandemic?
You are right on the money with that. That's exactly what I'm talking about. Look, we know that the future is going to be very, very different from what our past has been. We know that now. We're smart enough in this country to start restructuring our system. I'm one of those people, I grew up, my dad went to the seminary, was a minister, but he didn't make his living as a minister. He made his living as a contractor. He was a small contractor. He built and renovated houses for a living. He taught me early that all of us have roles to play. I think that we have to take a look at what is needed in our country and start restructuring our educational system in such a way that we recognize that doctors need plumbers, plumbers need lawyers, lawyers need electricians. We all have roles to play, and we've got to look at our educational system. I tell my caucus all the time, they keep saying, well, we got to do things so people can send their kids to college. Some kids don't want to go to college. Some kids want to be electricians. They want to be plumbers. They want to be landscapers. You don't need a 4-year liberal arts degree to be an electrician. But I'll tell you what, you ain't going to build a house without having great electrical wiring. So we have to train and educate for the future. Healthcare is going to be big going forward. Many healthcare jobs don't need a 4-year liberal arts degree. That's why I'm so glad that Joe Biden has taken on Sanders's mantra of having a 2-year free college because it doesn't have to be liberal arts college, it can be technical colleges. We have a plethora of technical colleges in South Carolina and all over this country. So let's look at education being more than 12 years, but maybe 14 years. That should be standard now. I remember my dad was not allowed education beyond the 7th grade. He was a grown man before he was allowed to finish high school and was never allowed to get a college degree because he never had a high school diploma. But he finished 4 years of college. These things are necessary for some professions, but none of that was necessary for him to build and renovate those houses.
Mm-hmm. Yesterday, there was a call. The National Parent Teacher Association discussed the social emotional learning for children out of school during COVID-19. This sort of social emotional learning is not an option for schools where their budgets are struggling. Is there any provision or any plans to allow for social emotional learning for students in lower funded communities? And that's a question from our audience.
Well, it's a great question, and I wish I knew the answer. Maybe it's time for me to call on Matthew. I don't know if I know the answer to that question. Matthew?
Congressman, I would say I haven't seen any proposals to specifically address that issue, but I think the most important thing is to get the virus under control, get the testing that we need, including the antibody testing, so we know who's immune, assuming that they conclude that having the antibodies, does in fact make you immune, so that schools can start up again on time and at full strength this fall. I think, there's already been great cost and that's going to continue, but I think the most important thing is to get everybody back in schools operating like normal, hopefully better than normal this fall, while at the same time expanding the broadband internet access, making sure that it's affordable, because, obviously going to school and interacting with people via Zoom and other video conference technology like this, doesn't replace the sort of in-person interactions you can have under normal circumstances. But it's a whole lot better than not having access to those technologies.
It's a great point.
Thank you, Matthew.
Yeah, so another question on how to expand the healthcare force. What would you like to see in terms of expanding healthcare providers, and particularly in places with underserved populations and in the context of emergencies like a pandemic?
There are two things I would like to see. Number one, we have been pushing, and I've worked with Brenda Sanders on this for years. In fact, we worked very closely together back when we were putting together the Affordable Care Act, to expand community health centers. I believe sincerely that there ought to be a community health center within commuting distance of every citizen in the country. Having community health centers, to me, could be the foundation, the ultimate safety net in our healthcare delivery system. And broadband deployment. I think that every community health center ought to be a hotspot. I got a little tabletop book that I keep that's entitled The Next Greatest Thing. It was written for the 50th anniversary of what we call electrifying, that's what I call the country. And someone testifying in the Rural Church of Tennessee said that the next greatest thing to God Almighty is having electricity in your home. Well, the next greatest thing is having broadband in your home. I believe that is going to be the ultimate. That's what I want to see. I want to see us spend the $65 billion that we need to spend to have 100% coverage of community health centers. I want to see us spend the $82 billion that needs to be spent for us to have 100% coverage of broadband in the country. To me, those two things will be critical to the delivery of healthcare going forward.
So I think we have time for one last question. And so we'll end talking about what we should be thinking about for politics and going into November. What should Democrats, starting from former Vice President Biden, who will hopefully be our next president, all the way down to Senate candidates, congressional candidates in tougher districts. What should we be saying to Black voters in terms of our messaging, and what should we be saying overall to the electorate in terms of why it's time for a change in leadership?
I think that what we have to really say to all voters, Black and white alike, that here is what electing a Democrat means to you. Here's what electing a Democrat means to your family. And here's what electing a Democrat means to your community. I think that we've got to focus like a laser on people, their families, and their communities. People have got to feel secure. Families have got to be stabilized, and communities have got to be made safe. Applying those three S's to people, their families, and their communities, that's what our message has got to be throughout this campaign. Forget all this other stuff. All these high-sounding platitudes, they don't mean a whole lot. People are now becoming a little bit insular. Let's make sure that we appeal to them.
Well, thank you so much, Congressman Clyburn, and also thank you, Matthew, for joining us today. And thank you to our audience for continuing to support this series on how COVID-19 is affecting Black communities. We will be continuing this series and encourage all of you to watch out for an invitation to the next one. Thanks again to the Congressman and his staff for helping us.
Well, thank you very much for having me.
Thank you, sir.
Appreciate it.